Now, as more Jamaicans test positive for the coronavirus, there appears to be a challenge contacting some of these individuals as well as their associates. It's resulted in great difficulty for health officials to do vital contact tracing, which is an essential part of curbing the spread of the virus. Javon Keys has that report.
The health system has been struggling to keep up. Before, it was a backlog in testing samples, and now it appears the government does not have enough resources to reach out to positive cases or their contacts. The ideal is for health officials to make contact within 24 to 48 hours, but things have become strained.
Is there not a challenge? Because we are getting reports of persons who claim to have tested positive but have not been contacted by the Ministry of Health. And it's more than the 48-hour threshold that you have reported.
All right, so Mr. Keys, I did say that it is because of the spike, there is a challenge in maintaining the standard.
And with that admission, there is a chance you may not hear from the Health Ministry after receiving a positive test result. We've been tracking 15 people who were recently confirmed with the virus in the last 2.5 weeks. The first 3 cases got tested through the public health system. After their results returned positive, they were contacted by a representative from the Ministry of Health who took names of persons they engaged with, and the official isolation orders were given. We were told the ministry representative said they would be in touch before the end of the isolation orders. Those have expired for more than a week and still no contact. The other 12 cases all tested through a private lab, and the results returned positive in 48 hours. It's been 5 days since the results and still no contact from the Health Ministry. Professor of Public Health at the University of Technology Winston Davidson says at this point it's not a surprise that the system cannot keep up.
The question is not to panic. That's the first thing. The second thing is to recognize that the government, based on the resources it has, both in terms of the manpower resources and also in relation to the material resources, will not be able to cope with this overwhelming surge of COVID.
He says the government has to focus its resources on persons in need of hospitalization. Professor Davidson says once you suspect you've come in contact with a positive case or you feel unwell, quarantine or isolate at home for a period of 14 or 10 days respectively.
Why is the isolation shorter than the quarantine? Because once you start to get symptoms, you know that in fact the disease has gone through a period of incubation where it does manifest itself of between, say, 2 to 7 days. So you already are in the 5th to 7th or 8th or 9 days of the disease.
You may also need to do your own contact tracing and encourage these persons to quarantine.
Given that we are in community transmission, one, your posture is that everyone is positive, and therefore you adhere to the protocols in order to protect yourself and to protect the person who you may come into contact with.
Javon Keys, TVJ News.